And the city of San Francisco is about 6 months into a pilot program taking a new approach when dealing with 911 calls involving mentally disturbed people on the streets.
A plan that does not involve law enforcement. KRON 4's Maureen Kelly tagged along with one of 5 teams which are spread out around the city, tackling what has become a very visible problem.
We have pants.
You have pants?
The socks are down. Oh, we have flip-flops.
A community paramedic with the Street Crisis Response Team is making sure her rig is packed up with supplies as they respond to their first call of the day.
We're going through far more Narcan than we ever have, simply because fentanyl requires that we give more Narcan per overdose.
She's joined by a mental health clinician and a peer counselor who's had firsthand experience with what it's like to live on the streets.
I've experienced homelessness. I've had involvement in the criminal justice system. I'm a recovering drug addict, so I check a lot of boxes.
They're responding to 911 calls involving nonviolent, mentally disturbed people. The pilot program is a collaboration between the city's fire and public health departments. It was launched by Mayor London Breed soon after the national outrage of the murder of George Floyd in an effort to rethink public safety. Each street crisis response team costs $1.7 million annually. There are now 5 spread across the city. A 6th team will be added to work overnight to help provide coverage 24 hours a day, 7 days a week by the end of July.
Our goal is for these 6 teams to be able to divert the roughly 10,000 calls that we expect that are coded as a mentally disturbed person away from a police department response to this team being able to respond.
It might be urgent psychiatric care, but not emergency care, which lessens the load on the hospital. It could be shelter. It could be primary care appointments. It could be food, and it could be water and blankets. Whatever it is to meet their need at that moment, we will do it.
The team also checks in with those they see on the street who look like they could be in crisis. They approach this man because he's wearing a coat much too warm for the weather. This team is trained in dealing with people in crisis who may have previously had negative encounters with those in uniform.
A lot of the tools that we utilize in the moment might be crisis de-escalation, really allowing them to feel heard, really allowing them to feel validated, trying to understand kind of the underlying what's going on for them in the moment. Oftentimes when people are in psychiatric distress, there could be very basic needs that are not being met in that particular moment that's leading to the psychiatric crisis. Sometimes it's as simple as getting someone water.
This man was given water and socks and left where he was. The most recent city data shows that of the approximately 1,500 calls they've responded to so far, 59% of the clients have had their crisis averted safely and remained where they were found. The goal is for the city's Office of Coordinated Care to circle back and try to connect them with services. 17% have been taken to the hospital. Another 17% have been linked to things such as shelters, detox, or sobering centers. 7% have been placed under an involuntary psychiatric hold for up to 72 hours, otherwise known as a 5150.
There are days where, we feel as if, we're just kind of Band-Aids on gunshot wounds, But then we'll have those days where, we'll connect 2 or 3 people to services, and we have a great Office of Coordinated Care, and they'll follow up with the person, and then, we'll hear from them that the person's thriving in whatever setting they're replaced in. So, yeah, it's challenging, but it's rewarding.
While we were out, the fire department's public information officer spots a person who's having a hard time staying upright and summons the team over. The paramedic checks him out.
Just get on the side of caution. We're going to maybe treat him with a little Narcan.
Despite the Narcan he was given, he still struggled to get enough oxygen, and an ambulance team is called in to bring him to the hospital.
With the strength of the fentanyl that's on the streets now, it's almost Narcan resistant.
They gave out another box of Narcan to the patient's friend, who was grateful for the help.
Saved my boy life because I wouldn't know what to do.
The city is looking to add other specialized teams to deal with those problems associated with chronic homelessness. The mayor is proposing to fund teams that would specifically intervene after an overdose, and other teams focused on well-being checks for people who may need medical help and shelter but aren't experiencing a mental crisis. The Coalition on Homelessness is also calling on the city to fund a proposed approach to handling nonviolent, low-priority 911 calls, such as a complaint about somebody sleeping in a doorway. That would bring in civilian, community-led teams to respond instead of armed officers. Maureen Kelly, KRON 4 News.